So you want to become a podiatrist.
I swear if he makes a foot fetish joke. Hello everybody, welcome back to my channel. My name's Dana. I'm a podiatric physician in my final year of residency, and I am super excited for my video today. There's a page on YouTube called Med School Insiders, and they have a series called So You Want to Be a Blank, where it's different medical specialties. So this weekend they made a video, So You Want to Be a Podiatrist, and I got sent this video lots of times. People wanted me to weigh in on it, so I'm gonna do that today.
So you want to become a podiatrist.
I swear if he makes a foot fetish joke.
You like feet? Maybe a little bit too much, but hey, I'm not one to judge. Let's debunk the public perception myths and give it to you straight.
This is the most common joke, by far, that people tell me. Oh boy. Let's keep watching.
In this series, we highlight a specific specialty or profession within medicine, such as podiatry, and help you decide if it's a good fit for you. Podiatry is the field specializing in the foot and ankle and related structures of the leg, both in medical and surgical management. They use principles from sports medicine, biomechanics, wound healing, and various surgical techniques.
This already looks like a really nice video. It's really well put together. The graphics are amazing.
Techniques to treat anything from discomfort and pain to discoloration or odor. Some common conditions podiatrists manage include plantar fasciitis, which is inflammation of the connective tissue on the sole of the foot, ingrown toenails, Achilles tendonitis, structural deformities such as crossover toes, nerve or vascular damage, ankle sprains, ulcers, infections such as athlete's foot, fractures, and bunions.
This is a pretty good list of all the basics that pretty much all podiatrists would see. Some see more trauma and surgery than others, but these are for sure the basics.
Care have comorbidities, meaning other chronic medical conditions, such as diabetes. Because of compromised blood circulation in the foot and resulting nerve damage, diabetics are particularly prone to foot issues, such as neuropathic ulcers from losing protective sensation.
Yeah, this is true. No matter what path you want to take in podiatry, during your training, you'll probably see a lot of foot wounds, mostly due to diabetes. So if you're squeamish, this might not be the path for you, but it is so important that these people are treated because preventing and managing these foot wounds prevents more proximal amputation.
On the other hand, some of your patients may be healthy athletes, and you'll be tasked with treating their ankle fractures or other acute injuries with bracing, casting, orthotics, or surgery. The conditions you treat within podiatry will be both acute and chronic in nature, sometimes for the same injury. For example, an acute ankle sprain, meaning soon after it occurred, is primarily focused on dealing with the immediate inflammatory process. If the patient continues to have chronic ankle issues and repeated strains, say 1 year later, the management plan changes. If they have scar tissue and structural changes, for instance, surgical intervention may be warranted.
If you're interested in seeing one of the surgeries for chronic ankle instability, Google internal brace. The video will come right up. This surgery is basically adding reinforcement over the stretched out or torn ligament, and there might be an arthroscopic component too to look at the joint itself.
Podiatrists will assess neurovascular, dermatological, and musculoskeletal components in making treatment decisions. While most presentations are non-urgent, urgent and emergent management may be necessary for open fractures, degloving injuries, compartment syndrome, and some infections. Podiatry is a misunderstood field, and as I joked about at the beginning of this video, many think podiatrists have foot fetishes. Maybe some do.
I can't do this. If someone had a foot fetish, the last thing they want to do is go into podiatry. You see a bunch of messed up feet.
But they probably aren't getting their kicks through podiatry, as they're working with diseased feet with ulcers, fungus, calluses, and interesting smells. Some believe podiatrists only cut toenails and give pedicures. While it's true that clinical care may involve trimming toenails and calluses for patients who are at elevated infection or bleeding risk, they do much more than that.
There's a notion by some of the population that podiatrists only do the things that he listed, and the reason behind it is really interesting. For one, in many other countries, podiatrists aren't routinely trained in surgery, so they're usually non-surgical. That's one reason. But the main reason is that years ago, podiatry training was nothing like it is now. It used to be there was just a podiatry school for 4 years, and then that was it. There was no residency, and now pretty much all of our programs are integrated with allopathic and osteopathic programs, and all of us have a 3-year surgical residency. The problem is A lot of people think podiatry is what it was 50 years ago, but we're in the 21st century podiatry now, so a lot has changed, and I think it'll probably continue to evolve.
Podiatrists run the whole gamut, from trimming toenails to surgical procedures. And last, many people confuse podiatry with pediatrics.
The most common problem. Like, many people, especially the younger generation, don't know the word podiatric. So if I say podiatric or spell it, they say, "Oh, so you like kids?" And I'm like, no, I don't. If I'm in the hospital, I'll usually say that I'm Dana with the podiatry team. And if they are younger and they seem confused, I'll say, like, "I'm here for your foot problem." Because I have to specify, they don't know what podiatry is. So online, I always just say foot doctor because it's so literal. And a lot of people, like, almost make fun of me for it, say it's kind of funny, but it's clear, it gets the message across, and no one thinks I'm a pediatrician, so.
Podiatrists earn their DPM, standing for Doctor of Podiatric Medicine, after attending podiatry school, which is 4 years.
I'll just add really quickly, this is 4 years after college. You need a college degree before that. Your first 2 years are your basic sciences and your system blocks. And then my Western U DPM program was shared with the osteopathic med students program, so we took all of our classes with them. Every single class, and we took the same tests and were graded on the same scale. But the difference is, while they were taking OMM, which is osteopathic manipulative medicine, we were taking our supplemental podiatry courses. So with this system, the majority of your time is spent with the shared curriculum courses, so you're basically trained as like physicians first and podiatrists second, but you do have several years of training ahead of you to hone in on podiatry.
But focus more heavily on podiatry in years 3 and 4.
I think he was trying to be brief here, but 3rd and 4th year are your clinical rotations. So basically you spend about a month at a time in different rotations in different hospitals. So you're working as you learn. Podiatry is basically a pre-specialized medical program, so we already know we're going to do it. Because of this, we're able to spend about half of this time in podiatry and then the other half in just general rotations. And there's certain ones we're required to do, so like ortho, gen surg, family medicine, internal medicine, infectious disease, other ones I'm forgetting right now. And usually when you're on these rotations, the hospital just gives you a badge that says medical student, and you have the same responsibilities as any other medical student there.
In the US, there are 9 podiatry schools with roughly 1,000 students applying each year and approximately 60% gaining admission. If you thought that applying to podiatry school would spare you from the MCAT, think again. Do note, however, that podiatry school admissions are substantially less competitive than either allopathic or osteopathic medical school.
This is true. A while ago I made a TikTok comparing American MD, DO, and DPM program stats. I'll just put them right here.
With a 3.4 overall GPA, more specifically a 3.2 science GPA and 3.5 non-science GPA.
I think there's a couple reasons for this. One is we have a lower applicant pool because not a lot of people know about podiatry. And the thing that concerns me about this a little bit is that easier to get into doesn't mean it's easier to get through. Like I mentioned, we take all of our classes with the osteopathic medical students, and we don't catch a break on the grading at all. So if someone gets into a DPM program that statistically wouldn't have gotten to a DO program, they're at a much higher risk of not making it. Our class, for example, we lost about a third from people dropping out or leaving for some reason. So I can pretty much guarantee you that out of the graduating podiatrist, the average GPA and MCAT is higher than this. So I would take that as a word of warning if you are someone that struggles academically and are considering this route.
After podiatry school, most states require a 3-year residency covering medical and surgical training, although the duration does vary by state.
It doesn't vary. It's 3 years, and there are just a small handful that are 4 years. However, there are 2 types of residencies. One is PMSR, which stands for Podiatric Medicine and Surgery Residency, where you train in surgery of the forefoot and maybe some of the rear foot. And then there is PMSR RRA, which is that plus a rear foot, so you're trained in both the forefoot and the rear foot. I'm in the one that is both.
And just like with MD or DO residency, podiatrists have various general and more specialized rotations. As a first-year resident in your postgraduate year 1, or PGY1, you'll spend anywhere from 2 to 6 months on podiatry and the rest of the year on core rotations, including anesthesiology, orthopedics, and emergency medicine. As a PGY2 and 3, you'll focus exclusively on podiatry, both in the inpatient and outpatient settings, gaining additional autonomy as your training progresses.
Yeah, the setup varies by program. So you'll definitely have off-service rotations your first year, but I also had off-service rotations my second year too. Like I was in ortho for a couple months and some other surgical subspecialties.
Podiatry is more male-dominated, with close to 60% of matriculants being men. However, the gap has been narrowing as more and more women enter the field. After podiatry residency, you can subspecialize further with podiatry fellowship, which are usually each 1 year in duration.
Yep, that's true. Fellowship's 1 year. Most people don't do one, but it is an option.
Sports medicine podiatrists deal with athletes and their associated injuries. It's the highest compensated, as it includes a high volume of quick procedures.
I feel like as a first-year student, everyone said they wanted to do sports medicine.
Conservative management is also common, including taping, padding, dressing, splinting, and casting.
Yeah, this is definitely something that we learn pretty heavily.
It includes a strong biomechanics component and incorporation of physical therapy modalities and rehabilitation techniques. Limb salvage and preservation podiatrists work primarily with diabetic or vascularly compromised patients. You'll be preventing or conducting lower extremity amputations, and therefore there is a heavier operative component to this fellowship.
A very large percent of podiatrists do at least a little bit of work in limb salvage, and the reason for this is the growing prevalence of uncontrolled diabetes. And as far as amputations go, that's the very first thing you'll do as a resident doctor. Those will be your first surgeries. So it's something that's very commonly done. So pretty much all of us do it, but whether or not you'll do it as an attending depends on.
The lifestyle may be more unpredictable, however, as you may need to take call. Reconstructive podiatrists are the most heavily surgical, dealing with complex reconstructions, such as in addressing 𝐂𝐎𝐍𝐿. Compared to other podiatry subspecialties, complication rates are higher and...
So this is the biggest thing people go to fellowship for: big recon cases or very complex surgical procedures. Big recon cases take several hours.
Public health podiatrists place an emphasis on quality care and preventive medicine. This subspecialization is best suited for those who want to think bigger picture about healthcare policy, clinical care, and making a wider impact on quality of care. Wound care podiatrists focus on complex wounds, managing infections, and limiting complications. It's highly interdisciplinary, incorporating elements from infectious disease, dermatology, vascular surgery, and plastic surgery.
Yeah. I would just add that limb salvage and wound care are one and the same.
There are other fellowships too, including trauma, pediatrics, and orthopedics.
So most people see a mix of everything that was just talked about. Although it is possible to niche down more, usually you're seeing a mix of everything.
There's a lot to love about podiatry. It's a low acuity field with great work-life balance, with podiatrists working generally 30 to 60 hours per week, depending on practice type and setting.
I completely agree with this. I think it's funny that we're at the point where we consider 60 hours a good work-life balance.
You aren't dealing with life or death situations, and outcomes are generally favorable. It's less taxing when your patients aren't dying on you, but note that depending on your clinical focus, some of your patients may have substantial complexity or comorbidities. Depending on your interests, there is some flexibility in your clinical practice. For example, you could be more or less surgical depending on your preference, or subspecialize with one of the various fellowship offerings.
These are some of the things that drew me to podiatry initially, so he definitely found some of the great things about the field.
One of the other benefits of already being comparatively narrow in scope compared to something...
Yeah, so you're still getting a medical school education, but your pre-specialized field, which allows you to begin your training in day one.
Or having to work extra hard to match into a particularly competitive specialty. Podiatry isn't for everyone. First and most obviously, you'll need to be okay with forever working on the foot and ankle for the rest of your career. The level of differentiation within podiatry is comparatively limited. You won't get the same social recognition, status.
It's true what he says about the social recognition and the status. I do love podiatry. I would definitely do it again in a heartbeat, but it's probably the biggest annoyance, and I think it's amplified since I'm someone who's online and people from Reddit can invade my comment section.
Compensation as going the physician route, despite spending 4 years in
and
podiatrists
are
and
physicians.
3 years in residency.
I'm not sure where he got these numbers, but as I'm looking at the Bureau of Labor and Statistics right now, the average mean wage for podiatrists is $151, and internal medicine is $210. So still a difference. I still don't think this is accurate though. It does depend very widely where you look. So for example, MGMA data basically shows 230,000 for non-surgical podiatrists and then 250,000 for surgical podiatrists.
And yes, we know your cousin's Toad's sister's twin makes $1 million per year as a podiatrist, but we're speaking to the US averages here.
That's so funny, because I also know a lot of podiatrists that tell me they make X amount of money, and I don't know whether or not to believe them. But who knows?
After all, you could say the same about high-earning outliers in just about any specialty or field of medicine.
I do think podiatry has a much larger standard deviation than average, so I do think there are a lot of outliers in both directions.
There's debate between orthopedic surgeons and podiatrists. Given the 5+ years of surgically focused training orthopedic surgeons receive, in addition to specialized foot and ankle fellowship, my orthopedic surgeon colleagues believe they are better suited for surgical management of the lower extremity.
I've had nothing but positive experiences with orthopedic surgeons that I know in real life. I know some of them follow me, so hi. In some locations, there's a strained relationship between podiatry and ortho. Because we are completely different fields, but naturally there is a little bit of overlap because they both could be surgery on the foot and ankle. But this definitely isn't everywhere.
If you need the ego boost that comes with being a physician, podiatry may leave you unfulfilled.
It's true what he says, because even though we have the same education as other physicians and our surgical residency, and even though we're recognized as physicians by the government, there's still people that don't want to call us physicians because historically we weren't. Historically we didn't have the level of training that we do now, and some people don't want to accept that.
How can you decide if podiatry is a good fit for you? If you want to build longitudinal relationships with patients, work with feet, and want to improve quality of life without the pressure of life or death decisions, podiatry may be a good fit. If you are comfortable focusing on the foot, but are not sure how medical or surgical you want to be, podiatry offers that flexibility.
One of the things he didn't mention that draws a lot of people to podiatry is it's extremely hands-on, whether or not you go more of the surgical route or even if you are doing non-surgical clinic things. It's a lot of hands-on and it's a lot of everything. So I don't think he mentioned that. But otherwise, he mentioned a lot of the things that are great about podiatry.
If you want to work in healthcare but aren't thrilled about how cutthroat and competitive pre-med can be, podiatry offers a more attainable alternative.
Like I mentioned before, you're more likely to get into a podiatry program than MD-DO. In my opinion, you should do podiatry because you want to do podiatry. You shouldn't do it because you think you might not get into MD-DO. I think that's a recipe for failure and being unhappy with your choice. So you should really only do this if it's the specialty that you want to go into, because there's no turning back, there's no changing specialties, at least for now.
If you like the idea of working within a smaller community, podiatry has you covered, with only approximately 15,000 active podiatrists in the United States.
He says only 15,000, and that sounds like a lot, but I swear podiatry is such a small field. Everyone always talks about in our community how small of a field podiatry is, and it's really true. This was a great video by Med Insiders. I really enjoyed watching it, and I hope you guys did too. So let me know if there's something I talked about that you want me to talk about more, and I can make another video about it. But I'll see you guys next time. And I was trying to play it cool, but what do you guys think about these lights? Aren't they awesome? Okay, I'll see you guys next time.